Thanks again, everybody, and thanks to our friends at AstraZeneca for joining us online for our roundtable discussion today, where we will discuss innovative approaches to driving cardiovascular health in our communities, featuring, again, our friends from Manna and Mallory. The American Heart Association reports that over 85 million Americans are afflicted with cardiovascular disease and remains a leading cause of death in the United States, a troubling and unacceptable number of lives affected. At the AstraZeneca HealthCare Foundation, we believe that one small but important way to drive change is to drive collaborative partnerships with our communities and our stakeholders and patient groups out in the field that are doing incredible work changing lives, one person at a time, one heart at a time. To date, the program has already included over 51,000 participants all across the country, and we're seeing real change, real, measurable, demonstrable change. These programs share the common values of being innovative, grassroots, serving communities that especially need it, and as I mentioned before, are enduring and geometric and passed from one family member and one generation to the next. There's no two organizations that do it better than Arenia C. Mallory and Manna Ministries. And what we're looking for today is an opportunity to amplify their voices and share for posterity so others can emulate what you're doing. So without further ado, to moderate our conversation is Dusty Dearman, who's the news director at WRJW here in Mississippi. Thank you, Dusty.
Thank you, Rich, for that introduction. First of all, I just want to say that I am very honored to be the moderator for today's discussion. This is a very important issue. It's an important issue that has had impact on my personal family, and I'm sure a lot of you have had this similar. It's something that is a very important issue for our state. According to the Mississippi State Department of Health, cardiovascular disease, including heart disease and stroke, is the leading cause of death in the state. This alarming statistic, coupled with the additional challenges in healthcare access and healthy lifestyle resources, has amplified the hurdles that many of our communities face. But today, the two programs we're going to be talking about, they're working to change that. Manna Ministries, the Heart to Heart initiative, engages the community in improving cardiovascular disease awareness. They also improve the quality of care through screening, through patient education, treatment, and heart-healthy lifestyle. They help reduce cardiovascular disease among primarily uninsured and underserved people. Joining us today from Manna Ministries, we have Dr. Aurora King, the program director of Manna Medical Clinic, Dr. Anthony Morales, a consultant cardiologist from the Louisiana Heart Hospital, and Mark Stockstill, administrator of Highland Community Hospital. Also, our second program is the Arenia C. Mallory Community Health Center in Lexington, Mississippi. This group's Take Control of Your Health program reduces diabetes-related complications such as cardiovascular disease among Mississippians in the community through an evidence-based intervention. This encourages and teaches people with diabetes how to be active, teaches them how to eat healthier, monitor themselves daily, take their medication, reduce risks, problem solve, and develop healthy coping habits for themselves and for successful diabetes management. Joining us today from Mallory, Executive Director Dr. Roselle Chapman, Program Director Tiffany Grant, and Behavioral Health Specialist Nadine Randall. I want to thank you all for coming today. We're going to take the next hour to talk with each of you and members of our audience regarding the burden of cardiovascular disease, the innovative approaches to fight cardiovascular disease, lessons learned from implementing programs, the impact of the AstraZeneca HealthCare Foundation support. So let's get started by reviewing how these groups are facing challenges associated with cardiovascular disease in our state. Our first question, we've noted that some of the alarming statistics related to cardiovascular disease occur in Mississippi. With that in mind, whoever would like to share, what is the biggest challenge in your community that you face with this disease?
So for us at the Mallory Community Health Center here in Lexington, Mississippi, one of our biggest issues is education, both education to learning healthy eating patterns, the variety of ways that you can improve the health of everyday foods that you're eating, as well as simple everyday exercises that you can do to help to improve your cardiovascular health and health in general.
I think the way you make a community healthier is by making each individual in that community healthier. And the way you do that is by modifying behavior. The unhealthy lifestyle, such as smoking, obesity, lack of exercise, has to be changed. And you do that through education and support, and that's where the programs put their emphasis on. It's hard to change your behavior by yourself and without support, and it's even hard to change behavior when you have support, but without support, you just continue the same lifestyle you've been living, and it goes through each person in each generation. And this is a way to stop that evolution of that disease and change the tide back into a healthier situation.
You know, I would also submit that education and that motivation needs to cascade down to a very early age, elementary school and on, to change that trajectory before it even becomes an issue.
I agree. There's also a lot of education that needs to be imparted, especially the role of what primary care is all about. A lot of people think that they only need us when they're already sick. So there's a lot of emphasis placed on health maintenance and disease prevention, which is the focus of what we do in our clinic, with special emphasis on addressing the risk factors, because studies have shown by the time they come down with diabetes or cardiovascular complications, they've already had problems 5 years prior to when you see them. So our goal is to keep them from developing complications, making earlier diagnoses, and aggressively addressing risk factors through education and aggressive pharmacological management.
And getting to the younger ages, we found with many of the grant awardees, it is a family thing. So sometimes it's getting parents more aware so they help change the habits for their children at a younger age. But vice versa, we've also had examples where sometimes the youth are more engaged and they've actually educated other members of their family. So it kind of has to work together.
Yeah, I think also what we have found out is not just the lack of education. It's actually a lot of need to debunk myths. And it's generational misinformation that needs to be addressed, and that is a real challenge.
I think in Holmes County, our primary site is in Holmes County that borders the Delta. We're a very rural area. We used to all be farmers, and we used to all eat like farmers, but we also worked like farmers. So now we still eat like farmers, but we don't work like farmers. So re-educating our folks, and even part of what we are planning to do is reintroduce the idea of working like farmers, even if it's just one plant in your backyard. So having access is one of the issues that we face, but we've been brainstorming and we've got a lot of issues that we're going to address.
And just to add to that, as everyone else was saying, education and, you know, encouraging people to make, not having these quick fixes and actually make a true behavior change. That's a lifetime commitment and something you have to do the rest of your life. It's not something for just right now. So that's something that we really encourage in our program, is that these changes are small, doable changes that you and your family can make together.
You know, I'm just reminded of an old Oriental proverb that says, you give men a fish and he'll eat for the day. But if you show them how to fish, they'll eat for the lifetime. And I think that somehow summarizes our mission in terms of our educational endeavor, is to give them the tools that they will need so that they can make practical applications of what they have learned. And it will yield large dividends down the road.
And I think all one needs to do is look at the outcomes of the participants in both of these programs to see that that truly is working.
Yeah, we're proud of the program because we can actually see objective, measurable changes. And for the last 2 years, more than 67% of our participants have demonstrated measurable improvement in their blood pressure, their cholesterol, their bad cholesterol level, and the control in their diabetes. We about 1.5% decrease from the baseline of their A1C, and I think that's a big accomplishment for the population that we deal with.
Is there something about having a place to come to that's important? There's someone that spoke last year said there was something really empowering about being able to get out of their home, to get away from their own sort of bad habits and to come to a place like this where there's workout equipment, but there's also other people. They're on the same journey, you know, sort of mutually reinforcing positive behaviors.
That's a common comment of our participants. In fact, some of them still attend classes long after they have graduated from the program because they feel that they can come to a place where they are cared for and are loved. And I think that is something that's so unique because it touches them, not just because we provide them physical care, but we go beyond what we can tangibly give them. And sometimes a clinic visit, all you do is just listen and oftentimes pray. This is a praying community, so we're open to offer them that option. And depression is very big. It's a big component of the patients that we see. Don't you think so, Dr. Rizal?
Oh, I agree. It's
Yeah.
it's almost a sense of it's a hurdle they can't overcome, and I think that's the first thing you learn when you get into these programs. Things can get better. We can help you change, and so it's hope. The hope is the biggest thing that's offered, and once you have hope, then you have motivation to change, and then you continue with the support that goes along with that, and things happen to these people that come to these programs that they would have never imagined would happen to them, and it's because the door is open for them to come in and change their life.
I would imagine while you're seeing this improvement in heart health metrics, that their overall well-being, their happiness, like you're probably seeing broader health benefits just because they've seen these physical results.
Depression is very common among folks who have cardiovascular disease, diabetes. It's almost like hand in hand. And that's the part of the program that I really enjoy when we talk to folks and really get them to understand that there really is hope. There really is hope, and it's not necessarily with whether or not I'll win the lottery, but it's whether or not I can improve my health, the health of my children, because often I'll say to them, you're sitting in this chair now, we're talking about this, so your child, your grandchild won't have to. You're going to learn, and the changes you're going to learn, you're going to pass them on.
We support, I like the comments about hope. Support a program in Boston where a woman stood up last year and said that she was the first adult member of her family to not have to endure an amputation as a result of diabetes. The first member of her family. And as a result of nutrition and exercise that she got from this community center. And, and she described it as, well, having diabetes and then having to have an amputation as a result of it was just something that happened. It was just a natural aging process, and it was, no, this is not actually the fate that you have to accept. It was really powerful.
I think one of the things about our previous funding that we received from AstraZeneca HealthCare Foundation with the Healthy Families Movement is we really took a holistic approach, and that we knew that I can't focus on just nutrition and exercise if there's the depression and the stress management. And so they always knew that Ms. Randall and I were there for them to support them, not only me as a registered dietitian, but as well as having that support from the behavioral health specialist. And as you stated, debunking those myths that you do not have to have an amputation. There are prevention and preventative measures that you can take to improve your health.
We've talked about depression, and we've talked about education as being some issues that need to be discussed and brought up, but what are some gaps or some unmet needs that you have in your community that you hope to address through this program?
To address the lack of fresh foods, the lack of areas for activities. We spoke earlier about how we want to start early in our children, and there aren't many activities for the children to be able to participate in, which translates into healthier adults, active adults that like to go things such as running or jogging, or to be outside with their kids playing sports. So those are some of the things that are missing in our community to kind of help keep that link. While it's great that we have participants that love to come to the gym and love to work out, everybody's not that way. And it's to be able to enjoy the community. Some people prefer to be outside and have activities where they can just have an active mindset to want to be able to be out and about in the world.
I think one of the things that I've found through my own research is just how truly difficult it is to buy and eat healthy. It's much easier to go to a grocery store and go right down the center and get those high carbohydrate, high fat items, which are very cost effective when it's compared to healthier foods. Finding some way to bridge that gap and partner with local grocery stores and whatever to really feature those healthy diet options.
I think we're just blessed to have the services of a volunteer registered dietitian through the University of Mississippi Extension Service. Dawn, I saw you. Yeah, she is the one who teach a lot on education, teach a lot on nutrition. It's not just information about foods, but how to buy groceries. She actually brings them to the grocery store, actually teach them how to read labels, apply what they have learned in class, which is a better choice, this food versus this food for the dollar amount. And we are now going to offer class on how to prepare food in a healthy way. And it's not just that, we also have volunteer health educators who facilitate our Zumba class, our line dancing class, and other exercise programs that we offer all throughout the month. So patients can look at this calendar and organize or plan their schedule around the offering that we have. So that is free to the public. We try to advertise it the best way we can, and we have good results, not just physical changes, but it's good for the soul.
Part of what Dr. Chapman started to talk about was the lack of access to really healthy food. That is one of our barriers, and we are working on that. We're starting to negotiate or just partner with a local organization called the Alliance for Sustainable Food Growth in Holmes County, and we have one of the members who will actually be working with us. We're planning to start a community garden by our clinic, some acreage that we have, and they're going to come and teach us some things, and we're looking into getting some other supplies and equipment from local organizations to help with this. But what we're going to do is teach people that you really don't have to have a lot of money to have healthy food. As I said before, even if you just have one tomato plant in your yard, that's a start. So those are some, with food being a barrier, we're going to address that and from more than one angle.
And just as you were saying earlier, how to actually prepare it. There's so many people that do not know how to prepare it correctly and properly, and to realize that you don't need all the extra things on it to taste good, and letting them actually just try the tomato and just eat the tomato and enjoy it.
And we have, Ms. Grant has also brought in consultants. We have had classes to teach us how to prepare our food. I heard a conversation earlier where we were talking about if you cook beans, you're going to cook them until they're mushed. So I learned a new habit when Ms. Grant brought this in. One of the demonstrations was about roasting asparagus, roasting beans without having to boil them down in a pound of bacon. So we're passing that on.
But that sounds good.
But roasting is also good.
You were saying last year, Nadine, that a lot of the origins of Southern cooking was, in fact, to get more calories out of the food that you had, right? And so we live in an era where that's not necessarily needed, but it just tastes good, right? So trying to unwind, what do you need for energy versus what tastes good, and tradition, and these things are all tied up.
We pass on what we learn. We teach our children how to enjoy food. So we need to unteach them some things and reteach them new things. And I'm very hopeful for that. We've made progress. I personally have a garden. I'm a farmer. So I have a garden, and I bring teenagers out to my farm, and they taste different greens. They will eat them raw. They will, does the curly leaf mustard taste different than this one? So if children learn that, and if they prepare that, they'll eat it.
Okay, well, now that we have taken a look at the issue of cardiovascular health in Mississippi, let's get to the innovative approaches that Manna and Mallory have been using. We'll start with Manna. Through your program, you leverage access to health care for uninsured and underserved participants as a way to improve their heart health. Can you explain how you do this and why it's effective?
I've capitalized on different methods of advertising the program to the community. We use media, we use technology. I think you can address more of that. We encourage our patients to share their experience, positive experience with the program, and not just by word of mouth. We also have extended our outreach to another community. We now have a free clinic in Poplarville, which is about 30 miles from Picayune, and we offer the Heart to Heart initiative to our patients from that clinic. We do health screenings, and we partner with other free clinics, and I think right now we have, Jamie, we are in the process of talking to some of the free clinics so that they can look at our program as a model for their own educational activity.
Okay, Mallory, in your previous program funded by AstraZeneca HealthCare Foundation, you used a health coaching approach that helped participants improve their cardiovascular health. Can you tell us why you took this particular approach and talk about how you're working with your community partners to implement these approaches?
As I was researching just evidence-based practices, just seeing that coaching model, and again, that holistic model and that team-based approach was so much more effective with that. So knowing that you had an RD that was your support system, you had the MD that's your support system, you have your behavioral health specialist that's your support system. So working all together to meet the needs of the patient. We found that was very successful, as well as the patients themselves having that community aspect of it, and really doing a partner approach to the program itself. So you had a partner that would help hold you accountable as well. So if they saw you at the grocery store, they would say, why weren't you at class on Tuesday? You know, so that also kind of helps. So we really made it a community-based effort, working with our partners for the fitness centers to get the reduced rates for the gym memberships, as well as, you know, finding free resources and places to hold our classes, because they would get pretty large. So we needed bigger space, just because once one person joined and enjoyed the program, they would invite family members. We literally had from siblings to cousins, moms. It was a really family approach to that program, and that really made it successful. Really having people knowing that someone's there to support you, and not only would Tiffany contact you, but then you had a sibling that would say, where were you today? And then they would say, oh, well, she's working it's voting day, so that's why she's not here. She's working the polls, but she plans to come in to weigh in, and having that accountability really helped with our program and its success. And then we did fun activities as well, you know, going to the grocery store together, doing the cooking demonstrations, recipe swaps. We really wanted everyone to be engaged.
I'm curious if social media, Facebook, the internet are helpful in terms of spreading the word, or if you find those are like internet access can be a barrier at times.
For us, we did do some social media, but I think for us it's really a lot of word of mouth, because everyone does not have access, and being in the rural area, didn't have access to the internet and Facebook. Our younger generation, of course, had it in texting, but our older generation, it was literally, I had to learn too, because sometimes I would text them and they would say, Tiffany, I didn't get that text message. And I had to start calling to make sure as well, because the older generations, they don't really text that very often. So I had to use a three-prong approach for advertising and getting people there.
The concept of coaching and having somebody help people navigate, I think, is a common thread we see in a lot of the programs that have had success around the country. We do work with a program in Arizona that is trying to take a look at what to do with returning Army medics, taxpayer trained, literally battle tested. They can provide emergency care on a battlefield, but when they come back from their service, they don't quite fit into any of our healthcare system certifications. And so different states, different policymakers are trying to figure out how to best take advantage of these assets that are returning from service. And in Arizona, one of the ways they're using them that works especially well in a part of the country where there's so many military retirees and service members, that having these Army medics become complementary to social workers and other ways to provide outreach has been hugely effective, to check in on people, to make sure that they're taking their medications, that they're adhering to the protocols they're getting from their doctors. But in that community with a lot of retired service members, being able to have a conversation with an Army medic is really powerful. In other parts of the country, it could be a social worker, it could be another member of the community. But I think this concept of one-on-one listening and engagement makes a big difference.
And really making it individualized to each person and to their needs versus giving everyone an 1,800 calorie meal plan. You really have to make it individual for them and find out what their likes are and dislikes are. Just because Tiffany likes asparagus doesn't mean they will. So you'll do it for the week, but then after, you're not going to do that. So finding foods that you like and enjoy and showing them how to prepare it.
Well, you touched on a couple of different of the impacts that your programs have had. What are some more impacts that you've seen from using the approaches you've been using?
One of the things is just that community support. I think was one of the successes that we had, as well as increased nutrition knowledge, really making better choices, and wanting to continue. Just like I believe Aurora mentioned earlier, they may have graduated, but they still come back. And they come back just to hear more and to continue learning more. They said that I say something different every time, but it's something, that little piece of nugget that they can take along with them. It has been helpful.
I think important in the approach that we've taken was the opportunity to provide the social, the emotional, the mental, and environmental support. If you're healthy physically, but if you're not healthy mentally, emotionally, socially, if you go home and you don't have a healthy environment, you're still not going to be healthy. So part of what we do is help them to find what works for them to improve their lives in those areas, to give them that emotional support, somebody you can come and talk to. Is not your best friend, and you're not going to have to worry about hearing it again in Walmart, you know. So that, I think, has been important. That's one of the best feedbacks that I've gotten. You know, it's really good to be able to just talk to somebody and not to tell them what to do, but help them explore their options, because if I tell somebody what to do, I'm going to have to take responsibility for the outcome. I'm not willing to do that, but I am willing to listen to you, list your options, and then choose the one that works for you. So that is a part of that whole coaching process, and I think that's worked well for us.
One of the limitations we have in our clinic is we don't have the capability of specialty services, and to meet that, to bridge that gap, part of our classes are our speakers are specialists in the area who volunteer their time to come and be available to patients if they have questions or information that pertains to their specialty area. And Dr. Morales has been very good at volunteering his time to talk about cardiovascular topics that they need in-depth information on. It gives them opportunity to ask a specialist questions, which otherwise won't be available to them because they don't have insurance, or they're just bashful to ask detailed questions during their clinic visits. So Dr. Morales is our cardiology volunteer. And we have other specialists in the community that has been volunteered by Mark Stockstill. So even though we cannot provide specialty type service, the information that a specialist can provide is offered to them. And I think that's really, we're grateful for the community support to help us meet that gap.
I just wanted to get back to the holistic approach that you were just talking about, and I think that's really so important. You're talking about lectures. The last talk I gave to the group was on stress, because really, if you look at most of the people who walk through a doctor's office today, 80% of their disease is related to stress, and especially cardiovascular disease. And it's about helping to lower the stress factors that they're dealing with by helping them be able to afford food and getting access to medical treatment. But it's also about managing stress, and that's what we talked about. And so the holistic approach is really the key to the whole thing. I've been practicing for 30 years, and you see a patient in the office and you give them a prescription for something for blood pressure and another medication for their cholesterol, but that's just the tip of the iceberg to maintaining good health. And that's what's so great about both of these programs, is that it gets to the core of the problem. Because again, to go back to the very beginning, it's all about behavior and modification of behavior, and then modification of your lifestyle and the way you approach life in general. So the holistic approach is the key to this whole program, and you can't do that without the support of AstraZeneca and the volunteers and the people that support both of the programs.
Well, both programs have had very successful years for several years, and many patients have learned quite a bit. But what are some of the key lessons that you have learned when you've implemented these programs?
I think one, from my experiences, never assume that they know. That's the only way I found out that most of the information that drive their decision making is based on erroneous information. So it gives me an opportunity to teach and to be able to give them the right information that they can base their decisions on. And the education process starts not just with me, but as soon as they get to the door. Everyone who is in touch with that patient during the entire clinic visit actually reinforces information, gives the patient the opportunity to ask questions. And so every member of the healthcare team has an active role in reinforcing or providing the right information. So it's everybody's responsibility to educate the patient.
In a lot of these instances, we're noticing that with some patients, we're actually starting at square one. Actually, to say that 3 fruits and vegetables a day, or drinking a gallon of water a day, are novel concepts that they are not aware of at all. That these are things that they should have been doing all their lives. So while they may go in and visit and we'll say, okay, you need to eat more green leafy vegetables. To say that I have no idea what counts as a green leafy vegetable, or how to prepare a green leafy vegetable, the things that we take for granted. To actually go to those building blocks and build them from square one all the way up to be able to have a knowledge base, to be able to fend for themselves and be able to make some good, healthy choices in their lifestyles.
It's interesting you said that. I have one example that's very typical of what you see in the South. I have a patient who really need to be adequately hydrated. And I asked him, are you drinking enough water? And he said, yes. What kind are you drinking? Iced tea. Coca-Cola. Anything but plain water. And to them, that provides adequate hydration, not to mention a pot full of coffee. So those are a little example, but very concrete example in how we can make a difference in terms of giving them the right information, capitalizing on each clinic visit to actually assess their level of information and how they apply what they have learned through the Heart-to-Heart initiative that's funded by AstraZeneca HealthCare Foundation.
And I think also remembering that your goals may not be their goals as well. And it's those things that, yes, they're losing 10% of their body weight and they're exercising, but one of the things that stand out to me is, I believe it was our first year of the Healthy Families Movement, and Ms. Randall was working with a patient who never looked at herself in the mirror and never saw herself as beautiful until she started losing weight. And that to me was so much more significant than the weight loss or the decreased blood pressure, all those things, because it helped me in the overall grand scheme of things, but it was the self-esteem that I was so proud of and so excited about. And I think, again, knowing that you have someone there that supports you and believes in you and you can come to, I think is one of the big things about our program. And that whole, as we were saying earlier, that holistic approach, because your mind has to be healthy. If we want them to get to that ultimate level of wellness, we have to deal with those lower level of needs that have to be met as well.
We found that too in a lot of the programs, was that sometimes this concept of health for the sake of health was a little abstract or maybe a little even indulgent. And so finding these connections where there was one woman in Illinois that we worked with that she had a year until her daughter's wedding. So for her, it was health for health's sake, and lower my cholesterol was nothing really resonated with her, but the concept of, being able to buy a dress and having photos for her daughter's wedding was what motivated her to change her lifestyle. So I think you're right. I think presuming that lowering your cholesterol or these things necessarily resonate with people, but they don't. You need to find more personal, meaningful reasons for people to do it, and they're all different.
And I think for one to personalize teaching, we really need to know our patient in a personal level. I think we're blessed to be in a community that's small. Everybody knows, almost what the needs are in the community, and we can tailor our educational approach to their level, not just to their educational level, but to their financial ability. So our program is practical in addition to being individualized.
And we would do these stress management surveys, and one of the things that we found was just financial stress. And so there was one day we talked about altering the class, and not about the nutrition, the exercise, and all those things, and we talked about finances, So again, just kind of meeting them where they are. And again, if you're concerned about how do you buy food, how can I get you to exercise, So really working with them on those types of things.
Okay, what best practices or ideas would you share if another community was looking to improve their cardiovascular health?
To tackle that holistic approach, to look at each patient individually, getting to know your community. We see and treat a lot of our patients in the community, but are we actually an ingrained member of that community where we know the needs of this family, or we know these are things that are coming out that are going to affect the workers in our area this month during the spring session or during the fall session, to be able to be proactive and be able to tackle some of those issues when they come above. So to reduce some of those stressors that they have when they're going to worry about finances. Okay, we know this is coming up. What can we do to kind of make food available? Okay, let's teach you on this is your off season where it's a little less work for you, where I can educate you a little bit more. I can teach you more about activities that you can do. I can teach you more about cooking. I can teach you more about your health in general, and just to be able to get you in a better mindset for when the times do get difficult. So it is a change and a stress in your life to be able to maintain these changes. And then sometimes just any other outside stressor can definitely throw someone off track, to make sure that you're proactive and ready for those.
I also think what helped is our team-based approach. Like Ms. Randall and I were kind of side by side, and knowing again that if I noticed something, I would go to her, and she noticed something, she would come to me, including our MD, all of us working together to help that patient. Is one of a really, so having, you need everyone at the table, all healthcare professionals need to be engaged with that patient.
And if I were to give some advice to a community who wanted to start a program, the first thing I would do is find out who the community influencers are. Notice I did not say the community leaders, those who influence people. I would also find out about the community. Is this a rural community? Is this more urban than rural community? What the needs are. So start from there and find out about the people. My first question when I start to engage with some of our patients and our clients would be, at the end of this process, what is it that you would like to have accomplished? So, as Tiffany said, sometimes we think we know what's good for everybody or what everybody should have, and we probably do, but we have to find out what it is that they want. So, and kind of put those two together, because we know folks need to be healthy. You need to have your blood pressure needs to be under control. That may not be what's important to that individual. Again, it may be somebody who wants to be pretty for her daughter's wedding or for her own wedding. It may not have anything to do with that. So we would have to do a needs assessment. I don't like that term, but that's what we need to do.
We also find that it's effective to get the community engaged. And one way to do that is through your guest speakers who are members of the community, the medical community, and your local community. Get your political leaders informed of your project so you can solicit their assistance. Get almost the other resources in the community, like the Extension Service, the University of Mississippi Extension Service, the Mississippi Health Department involved in it. So if they are engaged in your program, it just enhances the educational program that you offer in terms of not just content, but also in terms of support that can just, improve the program. There's a buy-in, not just by your patients, but by the community-led leaders. And we find that very, very important.
I feel compelled to return to your comments on combat medics and as a point of emphasis of just how huge that can be. Now, first of all, I had the honor of serving as a junior officer under Aurora here in the Air Force Reserve Unit. And so if I slip up and call her Colonel, please excuse me. Deployed medical personnel are much, much more than just treating battlefield trauma. They are experts in public health. Part of the mission is to get out into the indigenous populations and provide medical care. So they are experts at overcoming resistance and mistrust. And then, as I've heard today, that could be a little bit of some of the resistance. That's a huge opportunity, and thank you for bringing that up.
You talked about customization and finding what they really need. I had an opportunity to meet a woman who was part of one of the grantee programs in Baltimore last year. And she was happy to have lost weight and improved some things. But their program included things like boot camp, speaking of military, and kickboxing. And mind you, she was 67 years old. So my comment was, don't mess with Hattie. But she was as proud of how she had changed her active lifestyle as she was of the fact that I think she had lost like 10 pounds or so. But she really appreciated like the way she'd kind of changed her life a little bit and how she did things differently. And her face just lit up when she was telling me this story. And she's telling me kickboxing, like, which I can't do. So it's just how it changes their perspective on things in a much broader way, because was important to her.
Well, talking about the impact of the AstraZeneca HealthCare Foundation funding, how does this grant funding impact your community?
Because of the educational opportunities that was made possible by the grant from the AstraZeneca HealthCare Foundation, we were able to develop a program that we hope will sustain itself over a period of time long after the funding is over. And one way to do that is changing the culture of health. And I think, like what I've said earlier, if we give them all the tools that they need, which they can individually appropriate based on their needs, it is something that will pay dividends down the road. And that dividends is hopefully less complications from chronic illnesses that lead to stroke and heart attack, better management of their diabetes, better management of their high blood pressure, cholesterol, and other, hopefully they won't have any catastrophic cardiovascular event because their risk factors were adequately controlled, not because of what we did, maybe partially, but mostly because of their decision to buy into a healthy lifestyle. So that's what we hope to achieve with our program.
I would have to ditto Dr. King's statement because it gives us the opportunity to put together a formal program. It gives us the opportunity to integrate knowledge, activities, and the whole package to present to the community in a formal way. It gives us the ability to take the time that we need, because if you go to a healthcare professional, you've got a couple of minutes to do whatever it is you do when you're in there. But when you walk out in our program, we take time to answer your questions. We meet at a place everybody knows you're going to be there. We do things, we ask for their input. What is it, when I'm doing my part in terms of the groups that we do groups on stress, we do groups on financial management, we do groups on depression, we educate people. I approached one lady that I knew was clinically depressed, and the first thing she said to me, "You think I'm crazy?" And I thought, no, because if you were crazy, you wouldn't be in my office with the door shut. There's a difference between crazy and depression. So we found a lot of that. And the wonderful thing about the AstraZeneca HealthCare Foundation, it makes it possible for us to give them to put a package together and offer it to the community, a package that really works.
And I was just going to add, take that package and then integrate it into our other 5 clinics.
Yes.
And so therefore, you know, we learn from this one, and that lesson we learn from this one, we'll take it to the next one. What worked, what didn't work. So that allows us that opportunity to take that time on that first package, really get it together, and then we can integrate it into the Mallory Community Health System.
I think it gets back to what I was saying before about hope and just giving someone a chance. Mm-hmm. And I think everyone at this table knows what needs to be done to make someone healthier, but it also takes money along with volunteer and time. And I think that's what AstraZeneca HealthCare Foundation realizes, that it can be done, and if you need a little help, we believe in you, and we're going to give you the money to help you reach that goal. And the good news is it works. The numbers, I'm jealous of, you know, the Heart to Heart program, because their numbers are a lot better than what I get when I'm treating patients in my office. I can never achieve those goals on a basis or the volume that they've achieved. And it's a start. And at some point in time, hopefully, the community will buy into the whole program, and then at some point in time it may be self-sustaining, where between volunteers from the medical community and the non-medical community get together and say, this works and we can make our community healthier. So, but without a start, without some help, it wouldn't be realized. And that's the impact, is that It's the extra step we needed to get started, to get this going, to show that it can work.
You all shared a lot of different best practices and why you've been successful. The biggest thing that stands out, and from other organizations that have received grants from the foundation, is the results. I mean, you guys have incredible actual outcome results that show, demonstrable improvement in health. And so I think part of our reason for doing this is to invite other communities and organizations to reach out to you all and learn more. That's what makes it successful, is the fact that there's actually, we care about that very much. I think Rich mentioned we go through this arduous process once a year to kind of select who we think the best organizations are doing great work across the country. And one of the key things we look at is who's delivering actual measurable results. We have 3- and 4-time grantees here, so that's just evidence of kind of being successful at what you're doing. We appreciate it.
Looking forward, how will you learn from your partnership with the AstraZeneca HealthCare Foundation in order to grow and sustain your program?
I think we would look at what actually worked and how we can integrate that into what else is available in the community. In Holmes County, and in Lexington particularly, we have a Mayor's Health Council, and we're looking forward to partnering with that organization, and that adds to sustainability.
And I will also add, just learning your resources. If you did not know your resources, having this funding opportunity asks you to actually reach out to your different resources out there, whether it be nonprofit or working with, your state Department of Health or all those things, because just like Aurora was saying, that there are resources out there and they want to help support you. You just got to learn to build those relationships and build those partnerships.
It also helps develop a model that we can show to those other organizations that are wanting to help and wanting to get involved, that we have a program here that actually has measurable results. That these are the guidelines that we kind of do, and we can partner together and have similar formats that may be able to find and address other issues that are within our communities.
One thing we haven't talked about as much, I imagine both your organizations rely heavily on very generous volunteers and time, people helping out. And I actually think, I'd be curious your perspective, that oftentimes those volunteers get as much out of these opportunities as the people in it, because they feel like they're giving back and making a real contribution. Do you guys find that in your?
I'm glad you brought it up. I think what keeps the volunteers going is really the genuine desire to serve. I think we're more blessed than the recipients of our care, because we know it's something that we believe in, something that we were assisted with financially to carry out. We see objective results, and we see that our patients are satisfied and happy and are making changes. And those are intangible things that really makes a lot of difference. And what makes our program unique is the quality of volunteers we have, from the professional staff all the way to the technical staff. And I think the culture of service, the mindset that we're here to help, is clearly communicated by not just the provider, but from our speakers, from our guest lecturers, our politicians who always show up when we have an event. Mayor Pinero is here. I'm so glad to see you. And it's something that is communicated, not just by words, but by deed. And I think once the patient sees that, that is a very effective motivator, more than what we can ever do.
And I also think the volunteers that are, I know myself and Ms. Randall and I, we're so passionate about what we do, So the people that we bring in are just as passionate about it and excited and are willing to help, and they will call and say, when do you want me out there again? You know, I mean, they want to come back. And because they realize that they'll see these patients at the grocery store and they're like, hey, I remember when you talked da 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 da. And they're just so excited about it.
Speaking of patients, we have two patients from Manna Ministries program that have had extreme success, and they're going to be sharing their stories with us today. First, we'd like to introduce Liz Johnson. Liz, we understand you've lost 50 pounds and you're now a strong advocate for healthy eating. So Liz is going to share a little bit of her story with us now.
It's a pleasure to be here this morning, and thank you for inviting me to participate in this meeting today. My name is Liz Johnson. I was at the end of my rope. I was gaining weight, having health issues. Everything I tried to do did not work. It was just a quick fix. I came to the Heart to Heart program, joined it, and began to get tools to put in my tool bag in order to understand why I needed to lose weight, take charge of my health, just get a hold of what's going on. And I was able to do that through the special presentations of the healthcare professionals, the educational classes, the encouragement to exercise and the exercise classes, and the follow-up with the medical lab. It just turned everything around for me. I lost 54 pounds. I lowered my cholesterol, no more fatty liver. I was taken off one blood pressure medication, reduced the other blood pressure medication, and an overall blood panel lab work ended up being very good every time I've had it done. I don't even have words to say how much the Heart to Heart program means to me, because I feel like it saved my life. And I would gladly recommend this program to anyone and everyone, and I do. Thank you.
I would also like to introduce Benita Wynn. Benita began the Manna program. Since that time, she has lowered her blood pressure by 36 points and is now volunteering as a teacher. Benita, would you please come up and share your story with us as well?
I am so grateful to be here today. I do love the Heart to Heart program. I must tell you, I found out about the Heart to Heart program at a time when I had head knowledge, but it had not hit my heart. I had began to come to the groups, and at first I was a little reluctant to doing it, but as I began to go through all the classes, it made me realize that I was out of control, and it made me see myself as who God sees I am. When Jamie told us, listening to her talk about being jacked up, and I have that type of relationship with her, and I realized that I was jacked up, and God began to prick my heart and made me look at the program and be able to tell other people about the program. And through that, I began to teach the program. The stress management is what I needed. First, it empowered me and it encouraged me to be what I needed to be. I teach the barriers classes, and I also teach journaling your journey. The stress management, it was really, I think they made it for me. And through that, I'm able to live a healthier life through that, learning how to realize that I don't have control over certain things, but the things that I do have control over is myself and where I'm trying to go. And through Heart to Heart, it made me realize that Benita had to get control of herself. And I do thank them for it. Manna Ministry with the Heart to Heart has been a part of my life for many years. And I'm just, again, encouraged. And thank you all for inviting me to be here today to tell my story. I tell everybody about Heart to Heart because I want them to join it. It's almost like when I first got saved, I wanted everybody to get saved. It's like that with Heart to Heart. I want everybody to have that experience, to see that Heart to Heart really can change you. Thank you.
Now, at this time, we're going to open the discussion up to a brief question and answer session from the audience.
With some stuff that we're doing this year. We're having a little fun. We're going to do some, we're teaching about painting and drawing and just a kind of other ways to sort of handle the stress part. So we're trying to be a little more innovative with some of those. We haven't started the cooking class yet. We were going to do it Thursday, but we sort of got stormed out. But we're gonna start working on that some more. But yeah, we spend a lot of time on what's going on, you know, in our heart and our head in order to make the changes.
And the first thing I notice when I see Liz and Benita come up is the big, beautiful smiles each of them have on their faces. To say that getting healthy, we usually think about it, the doctor's coming down on us, got to get him, try to get me in line. But it's something that we can be happy about. Health is one of the greatest forms of wealth there is out there. And so being able to explore that and the benefits that come with being healthy or getting healthier or enjoying the steps that you're making on the journey. So I applaud you guys again. So.
Do we have any other questions? All right. Well, now we'll turn things back over to Rich for his closing remarks.
So thank you, Dusty, for moderating. Thank you to the governor in absentia for the proclamation, to Senator Hill, to Mayor Pinero, to Jamie every year for hosting us so graciously. To all of our panelists and to all of our folks here in attendance today that are celebrating these two amazing organizations. I think when we probably originally selected your grant applications, it was the formal program, as Nadine said. And it was a formal program that within the four corners of the application was innovative and grassroots, served a community that especially needed it. But what's caused us to come back year and year, and 3 and 4 years in a row is results and driving real change. And I think what people can learn by listening to today's panel, and not just by looking at the four corners of the application, are all the other things that you're doing to drive this change. Innovative things like listening, providing hope, driving culture change, educating people, providing pastoral care, financial literacy, mental health awareness, all of these things working together in addition to these programs are what's changing people's lives and changing one heart at a time for the better. So the AstraZeneca HealthCare Foundation is privileged and humbled to be affiliated with the Arenia C. Mallory Community Health Center and Manna Ministries. Thank you so much for all that you do.